Hi everyone, ladies and gentlemen, may I have your attention please because our session is about to begin and please have a nice day. Thank you. Okay, good afternoon everyone. Welcome to the Stigmatizations and Inclusivity in Community and Workplace Mental Health webinar by Global Mental Health Peer Network. I'm Yana, your host for today. I also would like to greet the CEO of GHMPN, Charlene Sunkel, Sandra, and Zek Marta. And of course, our amazing speakers from Bangladesh, Fahmida, Akter, Agus, Hasan, from Indonesia, and also Dr. Basma Tolba from Egypt, and all of our beloved participants. Okay. Everyone's World Mental Health Day 2023 is an opportunity for people and communities to unite behind the theme mental health is universal human right to improve knowledge, raise awareness, and drive action that promote and protect everyone's mental health as a universal human right. More than half of people with mental illness don't receive help for their disorder. Often, people avoid or delay treatment because they worry they will be treated differently or fear losing their jobs and livelihoods. This is because the stigma, prejudice, and discrimination against people with mental health disorder are still a huge problem. On the other hand, based on WHO data, 15% of working age adults were estimated to have a mental disorder in 2019. Globally, an estimated 12 billion working days are lost every year to depression and anxiety at cost of US dollar 1 trillion per year in lost productivity. People living with severe mental health conditions are largely excluded from work, despite participation in economic activities being important from recovery. Today, we will learn with our extraordinary speakers, Agus Hasan from Indonesia, Dr. Basma Tolba from Egypt, and Fahmida from Bangladesh to learn how to build an effective action to prevent mental health risks at community and work, protect, promote mental health at work, and support workers with mental health conditions based on their best practice and experience. Okay, everyone, let's jump in our first speaker, Fahmida Akter. Hello, Fahmida. How are you doing?
Hello, Yana. Hello, everyone. I'm really doing well. Hope you all are doing well as well.
Thank you. Before you share your presentation, I would like to introduce you. Fahmida Akter Angki is a member of the Country Committee Leadership Asia Oceania, representing Bangladesh at GMPHN. She is a person with lived experience of ADHD with comorbidities of depressive disorder and anxiety. Having to deal with such an ordeal with mental health in Maya actually drove her to do something for herself as well as her community. And also she started educating herself and volunteered as trained mental health first aid support provider in several community organizations such as Dream Psychology, Identity Inclusion, and then Men Speak Bangladesh and Innovation for Wellbeing Foundation. Hello, Fahmida. I'm very proud to talk with you and discuss with you about our topic today. Okay, Fahmida, your time is 15 or around 10 until 15 minutes. Okay, time is yours. Thank you,
Thank
Fahmida.
you. Thank you so much. Can I share my screen?
Yes, of course.
Yeah. Okay. Give a moment. Yeah. Thank you. Thank you, everyone. So I am Fahmida, as you've heard from Yana, and I am representing Bangladesh in CLC at Global Mental Health Peer Network. And so I don't want to waste much time, and I will straight go to our presentation. So, we are doing the World Mental Health Day special webinar series, and today our theme is destigmatization and inclusivity in our community and workplace mental health. So I took a little bit of a nerdy approach in my presentation, which is I will try to explore mental health through our life course approach, which means in different stages of life, how we're being affected mentally and how our mental health can be violated or even be better through our life stages. So we have certain needs and factors. So we are going to explore through this life course approach to understand better about preventing some risks and protecting and promoting mental health in the community. So in this presentation, what I have covered is, as you can see, a brief overview of mental health situation in Asia and Oceania, the region we are presenting for different age groups. I will show some statistics and some study results. And then we'll try to understand these mental health needs in different phases of life cycle, as I said, and also some theories and approaches to look to mental health, how mental health is being perceived from different psychologists and social scientists. So they have given some theories and approaches. By using them, we can take interventions and take our actions. And then possible some also I'll share some possible biopsychosocial factors and events that can affect mental health, and definitely then scopes of mental health intervention and recommendation to improve mental health status and gaps in Asia and Oceania region. So in this slide, I hope you can see the slide where I have stated some statistics and I have gathered some study results. So if I go through it very briefly, one systematic review that was published in 2021 by Barikan, he said it showed that the overall prevalence of any childhood mental health disorder in the study was 12.7%, with anxiety 5.2%, attention deficit or hyperactivity 3.7%, oppositional defiant 3.3%, substance use 2.3%, conduct disorder is 1.3%, and depressive disorder is also 1.3%. In another study, which was done in 2018, it said mental disorder patients in Southeast Asian countries have a poorer quality of life, which is estimated 53.2% compared to other chronic diseases. In another systematic review that was done in 2020 by M. Hussain and his team, he showed high prevalence rates for mental disorders, including depressive disorders, anxiety disorders, mood disorders, and suicidal behavior are found in South Asian countries, including children. It's a high prevalence. And another 28 study by Vikram Patel, he showed there is a vast gap between child and adolescent mental health needs and the availability of resources in low-income and middle-income countries, with Oceanian countries being affected by these issues. Another 2020 study actually studied on COVID-19 effect of COVID-19 and has led to various psychological problems such as anxiety, fear, depression, and insomnia, posing a serious challenge to mental health services in Asian countries. And then another COVID-19 studies that was published on 2020 that also shared another publication that was from 2019 that showed that mental health conditions in East Asia are influenced by factors such as retirement, family care, social mobility, and mortality for older people. And another 2019 study that was done in 6 Asian countries, that is China, Hong Kong, Japan, Singapore, Korea, and Thailand. It showed that Asians with mental illnesses are considered dangerous and aggressive, and psychiatric illnesses are less socially acceptable and viewed as personal weaknesses. So we can see clear stigma around Asia. And I have lots of studies, and we have many evidence that in Asia, we must look through our mental health conditions, our population, what are they are dealing with. We have very evidence-based information on this. But now what we can do? Now, all these things that are happening, what I want to link to these things is that these are all consequences of so many life events, so many life factors that are actually influencing us over the throughout our lives. So if I say that, and many social scientists, psychologists, they have been developing a lot of theories to understand what exactly the mental health or psychology of ours and how it can be addressed in various forms. So as you can see, I have documented some theories that you can see. I have written them and pointed them in the upper side of the slide. You can check that there are approaches of behavioral neuroscience. You can describe mental health from neuroscientific perspective. There are attachment theories, social emotional learning theories, grand theory, self-determination theory, behaviorism, cognitive psychological theory, and also some psychoanalytic theories. It's probably very much influenced by Freud and developed by Freud. And we can also see Maslow's hierarchy of needs very much used in workplace. And we can see that all of the institution, most of the corporate institutions, they use as a workers' performance and workers' attitude towards their work. So they also use this kind of psychological tools to assess their workers' condition, psychological condition. There are also biopsychosocial models, social cognitive theories, humanistic psychology, psychodynamics, transpersonal psychology, social psychology, and definitely there's psychiatry, biomedical model of mental health, what we can see. Also social psychiatry. Now, these theories can derive so many micro factors, micro level factors that actually are the daily life events of ours. From the beginning, you can also see the stages of life from the beginning, that there is infancy and childhood, that we can kind of define it from underage children, and then children grow up and transition into their adolescence period, and then go to their reproductive age, and then certainly they reach their young adult period, then they transition to the adulthood period, then it comes midlife and post midlife phases comes, and then we grow older and older again. So all through these years, there are so many factors from the beginning that affects. And what are these factors? We can derive these factors from these theories I have just told. It can be our identity, gender orientation. From the beginning, from the very beginning, that infants and childhood, there can be process of neurological development, biological development, and if the child has any congenital problem or any physical defects, if the kid is born with any physical defects, it can hamper his or her mental health throughout their life if not treated or addressed well. And as we can understand, there is parenting style, and if we look through the social structure, there's structure, can be structural violence, they can be subjected to sexual abuse, emotional abuse. And there can be factors of ethnicity, regional milieu, family personal values, person's growth mindset, even child's nutrition, and most importantly, mother's mental health. Pregnancy experience is one of the biggest factors for a child and their later development phases in their lives. And if we talk about work performance, behavior, efficiency, efficacy, and if we again look into the social modules, social structures, there is patriarchy, there's men's mental health is ignored, there is positive or negative masculinity, concepts of this masculinity. There is political influence, public policy, generational trauma, generation after generation. People hold their trauma, and they have their certain beliefs. There is, and also we all have neurodiversity. We are different from each other, and children born with autism, or anyone adult person who can get diagnosed with autism at later stages of life, and their living habits, their patterns, many complex trauma and their coping mechanism, and overall our economic expression, economic freedom, inequalities, equity, every situation we can consider. All things directly or indirectly actually affect mental health, and it affect our well-being. This and obviously there is social emotional empowerment is needed to have a better mental health status. Our education also plays obviously a very vital role. And if we look into in other different situation that the situation that can be more vulnerable for vulnerable communities, what makes a community very vulnerable? There can be migration, displacement, refugee. So they are very vulnerable community. And war, disease outbreaks. We just gone through COVID-19, a huge pandemic. This type of epidemics and pandemics also change our course of lives. So this is why when we try to um, change our try to look for our mental health, I think these things should be considered. Now, if we look, if we want to do something for the prevention, I think these are the factors. If we, since we have identified some few of them, we can acknowledge them and take our actions. So here I have put an umbrella. Mental health is a huge spectrum. So I have tried to put some scopes of intervention, where these are the scopes of intervention and actions for improving mental health status. We can look through these and understand the scope of prevention, and we can take age-specific intervention even and provide support and recovery solutions. So we can work on stigma enlightenment, and definitely work on, like psychiatrists and mental health professionals, they work on mental illnesses. And we are who are advocates or lived experience people who always try to create awareness through education by self-learning, either self-learning or community learning. So you can see that there are a lot of areas where we can invest in mental health. So some recommendations from my side, what I like to put up there is that, in my opinion, I think investment is a really big thing. So investment and conducting more mental health research programs is very important for identifying more factors and take more evidence-based action. What works for us, and with time, it also can prevent a lot of prevalences for later generations. So mental health research is must. This is where advocacy starts. This is where everything starts. And then I value prioritizing early interventions for children, because when the baby is born, from that time the person is being grown up, that person is learning about life. And that is when we should take this early intervention, and we can prevent a lot of mental health conditions and mental illness issues. And even before that, for better peripartum outcomes for mothers, it's also crucial. It's very crucial for having a healthy baby and the baby's life. So this is also should be taken into consideration for improving mental health in Asia and in Oceania region. The South Asian mothers are really vulnerable community, and I think they should have specific interventions for them. And then it comes, I would suggest development of comprehensive mental health rights law and policy for workplaces and institutions. Every community, every country, every workplace, micro, meso, and macro level, they should have some sort of a comprehensive mental health protecting rights. If we don't acknowledge it as mental health rights, and we won't be able to put all these works into action. So mental health rights is obviously very important. And then I'll say another important thing is that mental health literacy tool development, training, and campaigns in the community. We need to increase the mental health literacy. We need to create a certain level of awareness about a comprehensive mental health, that how we can ensure our well-being from our sides, and how can we get support if we need any help. So we need these awareness and information to us. And then it comes that creating pathways to more pro bono mental health workshops, trainings, or education materials, whatever, and even services for having more accessible and affordable mental health care. And then targeted interventions for more vulnerable community. It can be age specific. For older generation, they need another specific interventions or programs that can nurture them and actually meet their needs. And also early intervention, as I already said, it's also important. And youth intervention is also a big part of it. And then my last suggestion is establishing a strong political and economic justice in the society for protecting mental health rights. I think it's very basic that if we don't have political and economic freedom, it's impossible to be well in a society. So from my perspective, I think we need strong public-private collaboration, and having a overall and a holistic understanding of it, that how political economic role empowerment actually plays a role in mental well-being. So that's from myself, and if there's any question, I'm happy to answer.
Thank you, Fahmida. Wow, very amazing presentations. Let's give applause to Fahmida online. You're very great. And I'm very deeply agree with you when you talk about how COVID-19 or pandemic can affect our mental health as a community. And also you have a very large and very big perceptions. It's not about one life cycle, but you tell very detailed about the theories and approach to mental health throughout the life cycle. Thank you, Fahmida. Everyone, maybe you can wait to ask to Fahmida, but please hold on because we are going to jump into our second speakers, Agus Hasan Hidayat from Indonesia. Hi, Agus, are you there?
Hi.
Agus?
Yes, I'm here. I hope that
Okay.
you could hear me clearly in there.
Okay. Thank you. How are you today in
I'm doing great,
Indonesia?
but I think my connection is not as good as how we look today. So yeah, hopefully that I could still hear you and the other way around.
Okay, before you are going to presentate, I will introduce you to all of us. Agus is a young disability rights activist who is based in Jakarta, Indonesia. He is promoting the rights of persons with psychosocial disabilities in Indonesia. He works with youth with psychosocial disability through peer support group programs, social media campaigns, disability rights advocacy, and awareness campaign at different events to raise issues on person with psychosocial disability to the public. Also, Agus developed an OPD focused on rights of person with psychosocial disability with his peers called Remisi. Okay, we can wait for you. And please, your time is about 10 until 15 minutes. Time is yours.
Thank you, Yana, and hi everyone. Apologies because I'm not doing any kind of presentation today, but I'm just going to talk about it. Yeah, I want to show you a picture, but I can send you in a message a bit later because I'm afraid that the picture is a bit, how do you call it, like probably for some people it will affect their trauma. Yeah, so just to be informed before, but I will send it to all of you guys in the link. But if you are, this is about how do you call it? This is about violence for person with psychosocial disabilities. The picture, but yeah, just want to make sure that you are not opening it if you don't want to see it. But if you are curious and you think that it's kind of okay, but yeah, please feel free. So thank you, everyone. Greetings to all of you. And I'm not really sure. I think that you guys are from all sides of the world. And here I am from Jakarta. And it's a great honor to be here. My name is Agus, and I am a disability rights activist focusing on the rights of persons with psychosocial disabilities, especially the youth with psychosocial disabilities movement in Indonesia and the Asia Pacific. I define myself as a person with psychosocial disabilities who had an adverse or a bad experience of forced treatment in a rehabilitation center in an institution when I was a child in Indonesia. And from my point of view, when we talk about the stigmatizations and inclusive community in a workplace, I think this is crucial aspect when we want to change the perspective of persons with mental illness. I think we have to start from there. Raising mental health awareness is important and it is a critical point. However, we have to be very careful with how we see the mental health awareness movement nowadays. Why? Because I want to start with how we, as a movement in the global mental health peer network, deconstruct our point of view when we see the awareness of mental health phenomenon. When there is increased awareness about mental health, we have to look at the direction in which the understanding of movement is being shaped or built. Is this movement just seeing us as an object that are seen as people who need to be cured and to be treated in the name of abnormality, and it is benefit the pharmaceutical company or the industry or the health system, the professionals such as psychiatrists, or is it benefiting us as a person who live with the experience? Now we have to be very careful. And trust me, I'm not here for, how do you call it, like trying to make an enemy with any kind of movement out there, but we have to talk and discuss, you know, in a pretty like equal way. So when we talk about the movement on the destigmatization, are we really involved? I think that is the first questions. Do we really get the benefit from it, or is it the movement just using this to sharpen the biomedicalism, biopsychiatric perspective? Psychiatric and clinical psychologists dominancy that their perspective has been shaped by colonial history that constructed the society to see us as a persons with mental illness or disorder or mad persons or other things. I will let you guys think about it. This is a movement is it just moving, just using us to strengthen the economy of the industry of health services? Probably, we have to think about it. Or we could see that how the UN document nowadays write and degrade us based on the burden of economic in the countries. You could see the documents. It is, I think, another side that maybe it's not captured enough, or we not talk about it enough, as they are stigmatizing us in the document of the UN. I will give you the document later if you guys want to see them. So when we talk about stigma, we have to talk about the root of it, I think, which is ableism. Ableism is a system that creates and shapes the community's values about how they see people, bodies, and minds based on social construct about normality, intelligences, abilities, intellectualities, capacities, excellencies, and skill or other things. These colonialist and capitalist notions are systemic operations that lead individual or persons with psychosocial disabilities that determined that by the societies who we are as or our communities valued are shaped and constructed based on our appearance and the ability to behave and to take part in our communities. The psychiatric used by the colonialism as the tool to repress our freedom in the name of normality, with the name of arrogancy of normalism. So we should oppose and fight it. So when we talk about mental health from biomedical approach, it will not stop the narrative to legitimate the normalism as a culture that is still continuing to be practiced. And it is as basic argument to not just stigmatize us, but it is to lead the violence, the inhuman degrading treatment based on our psychosocial condition that nowadays in Indonesia, more than 20,000 people who are still in chains and who are still living in the institution that resembling like a prison. So as a survivor of institutionalization, when I see the stigma in society about persons with psychosocial disabilities, such as mad, insane, crazy, dangerous, lunatic, or any kind of typical words, they are strong enough to degrade us, not in just the words and their act, but also in our legal system that affects to the marginalizations of our community, the segregation, the institution, to put us in a systemic violence with confinement in the institution that is legalized by many laws in many countries, especially global South countries. So when we talk about mental health stigma, we often hear the lack of mental health services. I once asked my fellow in a peer support group session that I run with my organization. I asked them if mental health services, psychiatric and clinical psychologists, counselor, what else? You name it. The meds, the therapists are free and always available 24 hours in every corner of the street. Is your problem will be gone? I asked them and they respond to me in the peer support group. They say no. I asked them why. And they said, oh, because I get discrimination from the job. I am not fully accepted in my family. I'm not fully accepted in my community. And I think this is not a medical problem. This is more like a social human rights problem. I think we should start from there. So I want to emphasize that we have to talk about, when we talk about the mental health, it is not I am, how do you call it? It's not like I against the psychiatrists. It's not like I against clinical psychologists. I still have a very good relationship with them, but it's how do we sit together as an equal human being and we talk about these issues. And this is not just a medical problem. And I think this is more like a social and human rights issue, and I want to emphasize that we have to talk about community support system, not only psychiatric intervention. This is how we deconstruct the people's things about our understanding about persons with psychosocial disabilities or persons with lived experiences, and how to change the narrative from the public health to inclusive development through our act to see our identities from group of patients or whatever you name it, to person with lived experience, to subject of development, to change the treatment, to support system, to change the mental hospital to community-based psychosocial support service based on our needs and our voice, and to support the institutionalization program in every country, and to promote the inclusive community in every country, especially in my capacities in the global South countries. Thank you. Back to you, Ms. Yana.
Okay, thank you so much, Agus. Very great presentation. Thank you for bringing up about ableism and how to involve community more than not only about psychiatrist intervention. This very great, amazing presentation. Thank you, Agus, and everyone. Please hold on your question to Agus because we are jumping to our last speaker with Dr. Basma Tolba. Hello, Dr. Basma. How are you?
Hi everyone. Thank you for this informative and insight in both in presentation, Agus and Fahmida. Thank you very much. And I totally understand the lack of awareness and the lack of human rights and engagement of community. But we started this movement here in Egypt. We started to train more community service and also people who live the experience, so they can help them more. And to the destigmatization as well, and we're still in the first baby steps, but this is a very good point to be raised, and for more policy and systematic guidelines to be put. This is gonna be great. Maybe we start from here.
Okay, thank you, Dr. Basma. Before you presentate, I will introduce you to everyone here. Dr. Basma Tolba from Cairo, Egypt, is a psychiatrist, mental health specialist, Harvard Medical School associative alumni, mental health clinical research, professional mentor in the field of mental health, public health and psychiatry, as well as TOT-MH instructor, WHO mental health leadership instructor, and MH certified instructor. She more than 7 years of experience in both governmental and private sectors, including Karsar Aini Psychiatrist and Addiction Treatment Hospital. Okay, Dr. Basma, we can wait for your presentation. About 10 until 15 minutes. Time is yours.
I'm going to speak about mental health resilience because it's an important issue for all us to know, both people with lived experience as well as professional, because when we know the mental health resilience is about how the ability we cope with other stressors that we face, and how we protect ourselves from stigmatization and from putting more stressor on us. So I'm going to speak about what mental illness and what mental health resilience, and the difference between self-efficacy and self-esteem, and what are the most important practices that could help us to increase our resilience, and how we are going to take our after our mental health, and the small take-home message. Next slide, please, Zach. This is the international definition of mental health as regard to WHO. It's about three main components: the physical, and the mental and social well-being. Here we're gonna focus more about social well-being because this part is really, as August said in the previous presentation, it's not really taking a focus maybe globally and in the national level, taking the focus maybe after the crisis of the COVID, but we still have many deficiency points and need to be improved. But physical and mental well-being are taking more and more accesses and guidelines and intervention as regarding to the medical parts only, and they totally not even avoid, but some of the professional people didn't know about the importance of social well-being and the involvement of the society in the management plan. Next slide, please. So here it's mental illness is totally misunderstood with the society, that if I'm mentally ill, so I'm not able to go to work, I'm not able to get married, I'm not able to be a functioning and a productive person in the society. This is a totally misunderstanding. And I take this picture from our first campaign that we did from 2018, and we wanted to give more information to the society that not everyone with mental illness is as a dangerous person, and he could live in the society and could be as productive or maybe more than those of normal people. And we put another campaign that said, what is normality? Because normality is the long perspective from each difference from each other one, and there is no specific guidelines for what's normal and what's abnormal. But we all know that we are human beings that have respects and right to live in a good quality of life. And from this point, we start our first campaign in Egypt in 2018, and we still continuing it, and started mainly with children, because children are more easily to get learned, and actually they very helpful, and they learn fast, and they apply what they have learned in their school and their neighborhood. Their mothers are very cooperative with us. This is a small definition about what mental illness. It is as said not only by books, but I'm from my side. I put another defect two updates in this definition. What we all know, particularly I'm speaking from a professional background, they know that it's about a disability in social, occupational, and important activities in daily life. Previously, they also put any cultural differences as a mental illness, which is not right. And also any mental, if we get emotionally affected by whatever political or religious or maybe some trauma or loss of some of our beloved one, previously they were put as a mental illnesses, but now this is not right, and we do a research about that, and put in the guidelines, the new guidelines, which was published in 2022, that these 2 points are more important to take the cultural consideration. It's not when I am from another background or another culture, this doesn't mean I'm not normal or I'm mentally ill or I need to be hospitalized or take medication. It's all what we need to know is what the norm of this culture was. What's this culture about? You need to read more about your culture before you put your management plan, whether you were a mental health professional with any of your background, or you one of our society or one of our people with lived experience that's gonna help other people how to deal with their that doesn't want to say it's illness or, but it's about life challenges, because everyone in life has a challenge. This one of this. Next slide, please, Zach. So what's resilience? Next. Thank you. The most important core of resilience that we need to focus on, and what we make psychoeducation for everyone, it's about the magical word ability. It's my ability to be an active person in my life, So when I'm being an active and productive person in my life, I could help my neighborhood, I could help my family member, I could do more in my work, but this doesn't mean I take more beyond my abilities, because sometimes we have this passion and motivation. And if I can, for example, work for 4 hours, I said, no, maybe I work for 8 hours. It's not good for your physical or mental health or anything, because sometimes we find workaholics, they do nothing about any life, but they can work. Even they in their social life, if he was a father or she was a mother, their children say, we didn't see our moms, we didn't see our father, they only like just an ATM to give them money, and they do nothing about their children or even about themselves as well. So here is the magical word about resilience: is ability. Ability to avoid any challenge in life, is despite and overcome it, despite how hard it is, and having vision that if I'm having challenges now, it's not permanent. It's just a challenge that give me a lesson, and beyond this lesson, I'm going to have a growth and increase my mental resilience, which will in its way to increase my brain plasticity, because brain, as we know, it's just a muscle like any muscle. So the more you train your brain how to cope and overcome, and that when I'm here now, and it's not gonna last. When you have this perspective, both me as a lived experience and my professional, we will go to a good prognosis and will be more improvement and productive in our society. Next slide, please, Zach. So the component of mental health resilience, we can take it from or memorize it from the word SHIP. It's self-efficacy, intelligence, problem solving, and the most important component in it is having adequate social support. This is the most component and the most important part that we are all gonna work about it. So some people doesn't have social support. What we hear our rule is telling them, maybe we have a grandmother without their grandchildren, which is she lived alone and they didn't ask about them. And maybe in the next door, we find another children without their mom or without their father or grandmother. So we can connect them together. So we have an adequate social support. The more adequate social support you have, when you have this adequate social support, so you gain more skills about problem solving. So this is improve your ability in doing things regarding both aspects of intelligence. So the next part will increase self-efficacy, which is the major component of self-resilience. So it's an up ground arrow techniques. From having, the most important part of it is having social support that will lead to the major component at the end. Next part, please. Next slide, please, Zach. So this is the difference between self-efficacy and self-esteem. Both are abilities, but my ability to just hold things, this is called resilience. But my ability and my vision, and when I'm look to the mirror and say something, even about this, but all about we said before, the magical word ability. Next slide, please, Dirk. For children, it's a little bit different because they need to know things in very simple and attractive way. So really, when we want to speak to children and tell them about resilience, so we make sure that if they are confident, and if they have social support enough, if they have contribution, or they know what the meaning of coping skills, if they have connection, and this is the most important part, and if this connection is effective and the positive connection, or negative connection. If this connection helps them to face their challenges and learn more, or it is one of the challenges, this connection, because you know outside we didn't have this maybe in Egypt or in Arab world, we didn't have this law of human rights when there is a not good enough mother for their children. We didn't have the power of the law that we take this mother and teach her how to be more efficient, how to deal with her anger, and how to deal, for example, with her illness, and educate their children about that. And when she say I need to take break, and when she say I need to go for social support, or maybe I need to go for vacation to know more about myself, and in the same part they didn't harm their children. Absolutely, I totally agree with Fahmida and August. We still have this link and this gap in policy making and in human rights law. I hope someday we could do something like that, because as August said, he has this trauma previously when he was a child, and if we put a law that protects the children, it will help them more. And actually, those one who are going to abuse the children or miss or malpractice, even not in children and in the whole physical profession as well, if they have a law and if you know there is a law that protects this, actually testing is the abuse. Next slide, please, Deck. So there are the main 8 components of resilience. As you see, everything is related to social connection. What I do in social connection? In social connection, I touch and I do physical activity. I appreciate, I gratitude. I even just speak, or not even if not speaking, when I'm I'm down and I'm surrounded with some people and this social support is very good. They ask me, what's wrong with you? What about coming and having and eat ice cream together? What about coming and having a walk together? Not just there is it's not an important thing to do a big thing. Maybe we just say and tell stories to each other, and that will help us. So this is the main component of the resilience, is the social connection. It will this figures resemble the fruit of life. So every time we do more, it will increase more and more, and this will decrease the challenges that we face. And even if we have medication or we go to a health professional, that will improve our prognosis, because we are human being. We are not just an object or just an illness. We are a human being that we have more aspects in life. Next slide, please, Zach. And now this is the last guidelines that we done in our professional side to teach professionals how it's important, the spectrum of resilience, and how it's important the social support and peer support. And they need to ask their clients. We here in Egypt didn't say patient, we say clients. How they teach their clients to find social support, and if they didn't find social support, we put connection together. It's still small baby steps in the road, but it's going to be a globally one job. Next step, please. Next slide, please. Now it's the most important how we are looking after step. The other magical word in this presentation is having a routine. About having the routine, this doesn't mean that I'm doing something boring. No, I'm doing a small thing that I could able of doing it despite any challenges that I have. Do it regularly at the same time as possible, and it's in a pleasurable way as possible. Maybe sometimes for me, drinking a cup of coffee in the morning is something that makes me very happy and makes me overcome some challenges. Maybe you think about what you can do as a routine that could help you. Next slide, please, Zach. And maybe you can get up in the morning at the same time. Maybe you go see your movie. Maybe just you see the lamp at your room and meditate on it. And the other the magical word that I want to be taken into consideration in this presentation is resting. Because sometimes we not able, we didn't put a schedule for rest. When we put a schedule, we put a time for eating, put time for presentation, for how to improve my work, how to improve my personal skills, and how to improve my income. But did we put a schedule in how I do my rest, how I take my vacations? Maybe not only doesn't need to be a huge vacation, but sometimes just rest. Just have a 3 or 2 minutes per day during my work, during even.
Halo, Dr. Basma. I think she has a problem with connection issue.
Sorry for the connection. Can you hear me now?
Yes.
Okay. Okay. We about to finish. Yes. I didn't see the
Hello.
screen. Hello, can you hear me now? Are you hearing me? Yes.
Yes. Dr. Basma, your time is about 1 minute again. And after that, we can join 2 discussions.
Okay. Okay. Now the last slide, please. Jack. Next slide. So please take home message for you. Take care of yourself. What a resting time. Sleep well and meditate. And thank you.
Thank you so much, Dr. Basma, for your presentation about mental health and resilience. It's very helpful. Okay, everyone, we are going to discussion and or Q&A sessions. You can raise your hand or also have a question on the chat box. Or maybe you want to speak or open mic to our speakers. Or maybe Sandra or Claudia have questions.
Thanks, Yana. Sorry, I just wanted to revert to a comment that was made in the chat, and then I'd like to pose it to the presenters. I think it's something we can all relate to. Someone is struggling with depression and they are looking to stop taking their meds, and they're saying it's not easy. I'd like to just put that to the panel, and if you've got any words of hope or your experience or expertise, I think it would be nice just to share some support for Nozuko. Let's go with Fahmida first, if you don't mind, Fahmida.
Thank you for asking me that, and I hope that person actually finds appropriate support. And it's really hard to find a good therapist. Even not every therapist, not every psychiatrist, or anyone who you are talking to will be appropriate for your condition. And I know it's very struggling, and and I cannot even if I talk from my own experience. To be honest, when I was struggling with major depressive disorder, and I was diagnosed at very late stage, antidepressant helped me to overcome that mood disorders, the mood problems what I was having, the excessive sadness I was having at some point. Actually, for me, that medication for 6 months actually helped me to go through and feel better about it, better physically. And I even got out of my fatigue as well. Now, it actually is different for different people. If there's anything from my side, I would like to say, I hope you're taking advice from very good psychiatrist or any mental health professional. And if possible, I would say, if possible, take multiple advices and look and kind of validate if they're all same, or if there's any change, how you resonate. If I was in your position, probably I would do that. But yes, it's not hard and fast, and it's not specific for anyone, and it's not even like that you are being a burden, you are being a problem. That's what exactly August said, that we have this narrative that when we're going through something means, oh, we are the problem, or there's something wrong with us. It's not like that. It's a part of life. And I hope you feel better. And we are a supportive community. If there's any support you ask for, we will try our best to give you. And yeah, we'll have an ear for you.
Thank you. Thanks, Fahmida. That's it's incredible. Yeah, we've most of us on this call do have lived experience, Nazuko. So we do know where you're at. We can relate. So yeah, words of wisdom. Let's go to Agus, if you've got anything to say on that.
Thanks, Sandra. I actually don't have any kind of advice, but it's probably like the same. Maybe talk to at least three different types of experts. So maybe they could reduce slowly a bit the dosage of the medicines. But I don't really have a problem with medicines, as long as it works for me within 3 months, within 6 months, within 4 months. We don't know. Everyone is different, and you don't really have the side effects. I don't think that it's a problem, as long as it's covered by how do you call it, like in your insurance or your health coverage system. So because this is what I call extra cost of being psychosocial disabilities. So it might be expensive, but I don't really have I don't really have a word to against the medicine, because we need them. Why not?
No, that's great. Thanks, Agus. Is Dr. Basma still on? Sorry,
Yes.
then I'll bounce back to you, Yana. Sorry, I'm just going to the questions. Dr. Basma, do you have any words for the question, or any comments or advice?
I totally agree with Fahmida and Agus, but I also advise him, because in his state, I know it's very difficult for him to just pick a phone or get up from bed. Just motivate yourself to do something small around your routine. Maybe something, even if the something that you do, you were interested and make you happy before, doesn't make you happy now. Just try to keep on doing this, because it's helped you, even if it's not now make you happy.
Great. I just wanted to add, sorry, Yana, just with that, I know with depressive episodes, it's something that I do speak about a lot these days, is often we get inundated with reach out, ask for help, etc. And sometimes we actually just can't do that. We don't have capacity to do that. We can't just pick up the phone. It's too debilitating. So when you are in times of struggle, we need to reach in. And you need to learn to support yourself as much as possible. Yes, medicine is an assistant to mental health conditions, etc., but it's not the pinnacle. So it's the support. It's supporting yourself. It's learning as much as you can about the condition. So when you do, and if you have access to doctors, to psychiatric care, which some of us or some people don't have, at least you have the knowledge, and you can go in there with some kind of understanding about the effects of medication, about the possible symptoms that you may have. So yeah, like I say, just from my side, it is sometimes just reach in and do the little things, as Basma was speaking about in her presentation. Wake up, get out of bed, make a cup of coffee. It seems like it's nothing, but it is a lot on the difficult day. So just from my side, just that comment. All right, thanks. All right, and then just a quick word to the presenters before Yana wraps. Thank you. from the global office. It's been an incredible day of presentation, and I can feel your passion and your commitment and coming through your presentations, and it is incredible. We are lived experience experts for a reason. We not only know the knowledge behind it, but we do know the experience behind it as well. So thank you to Fahmida, Basma, and Agus today. Really appreciate it. And Yana, to you, of course, for your moderation as well. So thank you from us.
Thank you so much.
Thank you.
I hope it Fahmida and also Agus and Basma and Sandra can help the questions from Nozuko or everyone who is struggling with depressions and still taking meds, and you are not alone, and you are not, it's not your fault, and it's okay to taking meds for your condition. Mental health is better health and healthier. Okay, thank you everyone, and also our amazing speakers today. And we hope our webinar today can be helpful for everyone who's struggling with stigma in the community or also in the workplace. And I hope everyone can, the mental health services can be acceptable and affordable for everyone. And we can involve many people with lived experience to the mental health services. Thank you very much. Thank you, Zach. Thank you, Sandra, and everyone. This is very amazing webinar, and see you on our next webinar. Thank you, Global Mental Health Network, for facilities this amazing webinar.
Fantastic.
Thank you so much, Yana. Thank you.
Thank you.